Cholesterol is a waxy, fat-like substance that is found in every cell of the body. It plays essential roles in various bodily functions, including the production of cell membranes, hormones such as estrogen and testosterone, and vitamin D. Cholesterol is produced by the liver, but it can also be obtained from the foods we eat, particularly those high in saturated and trans fats. High cholesterol refers to elevated levels of cholesterol in the blood, particularly high levels of low-density lipoprotein (LDL) cholesterol, often referred to as bad cholesterol. It can also involve low levels of high-density lipoprotein (HDL) cholesterol, known as good cholesterol. High cholesterol is a significant risk factor for cardiovascular disease, including conditions such as coronary artery disease, stroke, and peripheral artery disease. It can result from various factors, including diet, lifestyle choices, genetics, and underlying medical conditions. Managing high cholesterol levels through lifestyle changes, medication, and regular monitoring is crucial for reducing the risk of cardiovascular complications and maintaining overall health. In this video, we will discover the 10 common signs that could indicate high cholesterol levels in your body. Learn why these symptoms should not be overlooked and how they may affect your overall health. From chest pain to vision problems, find out why it's essential to recognize these warning signs and take action to manage your cholesterol levels. Don't ignore these signs, prioritize your health and well-being by understanding the potential implications of high cholesterol and seeking appropriate medical guidance. 10 common signs of high cholesterol you should not ignore. 1. Chest pain or angina is a common symptom of heart problems, including high cholesterol. It's often described as a feeling of pressure, tightness, squeezing, or heaviness in the chest. Angina occurs when the heart muscle doesn't receive enough oxygen-rich blood, usually due to narrowed or blocked arteries. This can be caused by the buildup of cholesterol and other substances in the arteries, known as atherosclerosis. Angina can also manifest as discomfort or pain in the shoulders, arms, neck, jaw, or back. If you experience chest pain or suspect angina, it's crucial to seek medical attention promptly, as it could indicate a serious underlying condition like coronary artery disease. 2. Yellowish patches on the skin, especially around the eyes, are called xanthelasma. They can be a sign of high cholesterol levels in the blood. Xanthelasma occurs when fat deposits build up under the skin, typically around the eyelids. These deposits, known as xanthomas, are often yellowish or orangish in color and can vary in size from small bumps to larger patches. While xanthelasma itself is usually harmless, it can indicate an increased risk of heart disease or other cardiovascular problems associated with high cholesterol. Therefore, it's important to have your cholesterol levels checked regularly and consult with a healthcare professional if you notice any unusual skin changes. 3. Pain in the upper abdomen can be associated with high cholesterol levels, particularly if it's caused by conditions like gallstones or pancreatitis. Gallstones are hardened deposits that form in the gallbladder, often due to an imbalance of cholesterol and bile salts. When these stones block the bile ducts, they can cause sharp or cramp-like pain in the upper abdomen, typically on the right side. Similarly, pancreatitis, inflammation of the pancreas, can occur due to high levels of cholesterol in the blood, leading to abdominal pain that may radiate to the back. While not all upper abdominal pain is directly linked to cholesterol, it's important to consider cholesterol levels as a potential contributing factor, especially if other risk factors are present. Consulting with a healthcare professional for proper diagnosis and management is recommended.
Hello friends, it will be a pleasure to have you like this video, and subscribe for more videos like this. Don't forget to turn the notification bell to help you get notified whenever we upload a new video. Thank you.
4. Numbness or weakness in the limbs can sometimes be associated with high cholesterol levels, particularly if it leads to conditions like peripheral artery disease (PAD). PAD occurs when cholesterol plaques build up in the arteries, narrowing or blocking blood flow to the limbs, typically the legs. This reduced blood flow can cause symptoms such as numbness, weakness, cramping, or pain in the affected limbs, especially during physical activity. In severe cases, PAD can lead to complications like tissue damage or even limb amputation if left untreated. Therefore, it's essential to address high cholesterol levels to help prevent or manage conditions like PAD and its associated symptoms. If you experience numbness or weakness in your limbs, especially in combination with other risk factors for cardiovascular disease, it's important to consult with a healthcare professional for proper evaluation and management. 5. Difficulty in breathing can sometimes be associated with high cholesterol levels, particularly if it leads to cardiovascular conditions like coronary artery disease (CAD). CAD occurs when cholesterol plaques build up in the arteries that supply blood to the heart muscle, causing them to narrow or become blocked. This can reduce blood flow to the heart, leading to symptoms such as chest pain, angina, and shortness of breath, especially during physical exertion or stress. Shortness of breath, also known as dyspnea, can occur when the heart is unable to pump enough blood to meet the body's oxygen demands. Additionally, high cholesterol levels can contribute to other risk factors for breathing difficulties, such as obesity or hypertension, further increasing the likelihood of experiencing dyspnea. If you experience persistent difficulty in breathing, it's important to seek medical attention promptly to determine the underlying cause and receive appropriate treatment. 6. Yellowing of the skin and eyes, known as jaundice, can indicate liver involvement related to high cholesterol levels. While jaundice is more commonly associated with liver conditions like hepatitis or cirrhosis, it can also occur if high cholesterol levels lead to complications such as fatty liver disease. In fatty liver disease, excess cholesterol and other fats accumulate in the liver cells, leading to inflammation and impaired liver function. This can result in jaundice as the liver struggles to process bilirubin, a yellow pigment produced when red blood cells break down. If you experience jaundice, it's essential to consult with a healthcare professional to determine the underlying cause, which may include high cholesterol levels, and receive appropriate management and treatment. 7. High blood pressure, also known as hypertension, can be associated with high cholesterol levels. When cholesterol levels are elevated, cholesterol plaques can build up in the arteries, causing them to narrow and become less flexible. This increases resistance to blood flow, which can lead to an increase in blood pressure. Additionally, high cholesterol levels can contribute to the development of atherosclerosis, a condition characterized by the buildup of plaque in the arteries, further exacerbating hypertension. High blood pressure is a significant risk factor for heart disease, stroke, and other cardiovascular complications. Therefore, it's essential to address both high cholesterol levels and hypertension to reduce the risk of cardiovascular events. Lifestyle changes such as adopting a healthy diet, exercising regularly, maintaining a healthy weight, and reducing stress can help manage both high cholesterol and high blood pressure. In some cases, medication may also be necessary to control blood pressure and cholesterol levels effectively. Regular monitoring and management of both conditions are crucial for maintaining overall heart health. 8. Excessive sweating, especially when not related to physical activity or heat, can sometimes be associated with high cholesterol levels. This symptom is often seen in conditions where cholesterol buildup leads to cardiovascular issues, such as coronary artery disease or peripheral artery disease. When cholesterol plaques narrow or block blood vessels, it can affect blood flow to various parts of the body, including the skin. This disruption in blood flow may contribute to changes in sweating patterns, leading to excessive sweating even in cool environments. However, excessive sweating can also be caused by a variety of other factors, such as hormonal imbalances, infections, medications, or underlying medical conditions. Therefore, it's essential to consult with a healthcare professional to determine the underlying cause of excessive sweating and receive appropriate evaluation and treatment. If high cholesterol levels are suspected, further testing and management may be necessary to address the underlying cardiovascular risk factors. 9. Small, painless lumps under the skin, known as xanthomas, can be a characteristic sign of high cholesterol levels. Xanthomas are deposits of cholesterol-rich material that accumulate in the skin, forming yellowish or orangish nodules. These can often be found on areas of the body where tendons or ligaments attach to bones, such as the elbows, joints, tendons, knees, hands, feet, or buttocks. Xanthomas are typically benign and painless, but their presence can indicate an underlying metabolic disorder, such as familial hypercholesterolemia, or poorly controlled cholesterol levels. These deposits can vary in size and appearance, ranging from small, flat spots to larger, raised bumps. While xanthomas themselves are usually harmless, they can sometimes be associated with an increased risk of cardiovascular disease, particularly if they are extensive or occur at a young age. If you notice the presence of xanthomas on your skin, it's essential to consult with a healthcare professional for proper evaluation and management. This may involve further testing to assess cholesterol levels and determine the appropriate course of treatment to lower cholesterol and reduce the risk of cardiovascular complications. 10. Vision problems can occur if cholesterol deposits affect the eyes, particularly if they impact the blood vessels that supply oxygen and nutrients to the retina. Cholesterol deposits can lead to conditions such as atherosclerosis or arteriosclerosis, which can cause narrowing or blockage of the blood vessels in the eye. When the blood flow to the retina is compromised, it can result in various vision problems, including 1. Blurred vision. Reduced blood flow to the retina can lead to blurry or distorted vision. 2. Retinal vein occlusion. Cholesterol deposits can block retinal blood vessels, leading to a condition known as retinal vein occlusion, which can cause sudden vision loss or distortion. 3. Retinal artery occlusion. Similar to retinal vein occlusion, cholesterol deposits can block retinal arteries, resulting in a condition called retinal artery occlusion, which can cause sudden and severe vision loss. 4. Glaucoma. High cholesterol levels may also contribute to the development of glaucoma, a condition characterized by increased pressure within the eye, leading to optic nerve damage and vision loss. If you experience any changes in vision, it's essential to consult with an eye care professional for a comprehensive eye examination. They can assess your eye health, identify any cholesterol-related issues affecting your vision, and recommend appropriate treatment or management strategies to preserve your vision. Additionally, maintaining healthy cholesterol levels through lifestyle modifications and medication, if necessary, can help reduce the risk of vision problems associated with high cholesterol.